Hey, this is Dr. Tom. I just wanted to follow up with a little bit about what I was talking about yesterday in the video we did. We showed a couple x-rays of a female high school student, a very physically active female high school student, and a couple of the problems that she was presenting with. Not only was she having pain and discomfort in her mid to lower back, but on her x-rays, we were showing on the side view of her neck that she had lost that good head position, so we call that forward head posture, forward head syndrome, whatever you want to call it. But she lost that proper positioning. Head moves forward, lost curve in her spine, loses that proper curve that she has in her neck, and as a result of that, that pressure has to go somewhere and starts to build up, and your body compensates, and it now starts to create these lateral curves, these bad curves that we don't want in your spine. And as a result of that, now she starts to develop pain and discomfort. And in the long run, it starts to open the door for bigger problems to rear their head as she continues to get older. So our job, the point that we make, our job is to fix these problems. All right, I'm not a short-term fix. I'm not a band-aid. Our goal is to fix the problems, to get your body to function at its greatest potential, and that's what we do. And I made the point that we're going to work her specifically in our office and get her to do the right things at home. And we break that up. There's all different types of tissue that goes on that you have in your body. So when you're looking at your spine, you have the joints of your spine, obviously. You have the discs. I'm sure you've all heard that term before. You have the disc in your spine. You have ligaments, you have muscles. You have all these different types of tissue. They all respond to different types of therapy, different types of treatments. And that's where we break it up. We break it up into warm-up procedures, warm up the spine properly, so that when we go in, we do the adjustment goes nice and smooth. The adjustments are critical because that's what gets these bones to move. If we don't get these bones, these joints to move, at the end of the day, you still have a problem. You may feel better temporarily, but if the bones aren't moving and doing their job, at the end of the day, the problem's just going to come back. And it could be 3 months from now, it could be a year from now. But the problem, I promise you, is going to continue to come back unless you get these things to move. And then we have our post-adjustment procedures. And I brought up here that we use things like this crazy-looking roll here that we get people to lie on, but that's what gets in and helps to start to get these adjustments to hold for a longer period of time, helps to get the better positioning that we're looking for in the spine, so that when we do our pre-x-rays at the beginning of the care plan to our x-rays at the end of the program, now we're going to see changes, and based on that, we can continue to give people the right things to be doing outside the office to make sure they're always going to be moving forward, and two, never to be going backward to where they were when they first came into the office. Again, our goal, fix the problem and keep the problem fixed.